Confidentiality can be a difficult topic to talk about during an adolescent visit. The scenario you are about to see may not be the best approach to take when engaging an adolescent, especially around topics that would be best kept confidential. Let's take a look.
Hi, good afternoon, Mrs. Smith. It's good to see you. You can go ahead and fill out this form and take a seat.
Okay, thank you. Oh, I think you need to fill this out.
Anthony, your exam is completely normal, so that's great news. Now, I did want to follow up on the Bright Futures questionnaire, which was the questionnaire he had filled out when you first arrived. I noticed on there that you mentioned you've been feeling kind of stressed and anxious recently. Can you tell me a little bit more about that?
Oh, he made a mistake. He's been real happy.
Oh, okay, that's great. So happy and healthy.
Yeah, he's our track star. He just broke the school record.
Wow, fantastic. He's a fantastic student and he's doing well on the field. Anthony, you're so healthy, I don't think I need to see you for another year, okay? But keep breaking those records.
So it looks like the physician and mom walked away from this visit feeling very positive about Anthony's health. However, it appears there were some missed opportunities, especially when he indicated he has been feeling worried and stressed. So let's take a look at this next scenario where addressing confidentiality changes the whole dynamic of the visit.
Hi, good afternoon. It's good to see you, Anthony.
You too.
If you can go ahead and fill out this form and take a seat on this side, and Mom, if you can take a seat on that side. Thank you.
Anthony and Mrs. Smith, you may remember that last year I said that this visit I would spend a little time alone with Anthony, just kind of talking about his life. Would that be okay?
Yes.
All right, so you both know, the point of that is Anthony's growing up, he's becoming a young man, and I would love to see him take even more control of his own health care. A big piece of that is being able to communicate with me and ask his own questions. Would this be an okay time to do that?
Yeah.
All right, Mrs. Smith, why don't you follow me? Anthony, overall, I think you're doing really well. Your exam was normal, and it sounds like school's going well too. Is that right?
Yeah, I told you that I was going to work really hard to break that record, and I did, and it feels really good.
That's really fantastic. I'm really proud of you for doing that. I was also reviewing the Bright Futures questionnaire that you filled out earlier. In general, your responses overall looked pretty good. Is that right?
Yeah, for the most part, things are going pretty well.
Now, I did want to ask you about one item in particular. On the questionnaire, you said that you've been feeling kind of anxious and stressed recently. Tell me a little bit more about that.
I mean, it's not like anything bad, I guess. I don't know. Sometimes I feel like I'm different from my friends. Like, what if I'm just not that into girls? Is that weird?
Anthony, I don't think that's weird at all. Can you tell me a little bit more, what in particular about that worries you?
I just sometimes feel like I'm not as into girls as my friends are. I mean, I don't know, if my parents found out, they would kill me, and I know all my friends would just drop me if they thought that I was, like, gay.
Anthony, this time of life is almost always really confusing and complicated. I think it says a lot about you and your character that you're willing to come here and talk to me about that. I'm really proud of you for that. Now, you're not alone. There are a lot of young people just like you asking similar questions, and you don't have to figure it out overnight. I wonder if together you and I can think of other people in your life that you trust, that you can talk to as you're continuing to think about this. I would love to be one of those people for you as well. Would that be okay?
Yeah, that'd be really good.
What if we set up a time, maybe in a few weeks, you can come back, we could reassess your asthma, and we can also talk further on this.
That sounds really good. Talking about this has already made me feel a lot better.
Okay. Let me go grab your mom. Mrs. Smith, Anthony and I just finished talking, and I wanted to let you know I think he's doing really well. His exam was normal, and he's making great decisions. He and I thought maybe we could meet up again in about a month or so. We can talk a little bit more about his asthma just to make sure it's under control during track season. Would that be okay with you?
That sounds great.
All right. I'll see you guys next time.
Anthony definitely had a lot on his mind coming into this visit, and fortunately, the physician created the opportunity for him to voice his concerns. This scenario speaks to the relationship that had been developed between the patient and provider over time that allowed Anthony to feel comfortable to talk about his worries. There are a lot of things to consider when addressing confidentiality. Please be aware that this conversation should happen gradually. Beginning at age 11, the provider should begin preparing the family for individual time with just the patient. There should also be discussion about confidential records and when the provider is obligated to break confidentiality to inform about potential life-threatening behaviors.